So I just wanted to do a quick overview of the different licensure titles that exist in the world of psychology, because it can be really confusing. I've heard confusion among close friends and family, as well as just clients who call the office and are just curious. They don't really know where to go, what to do, what kind of therapy they're supposed to get for themselves or their child, etc. So hopefully this will be helpful. We're just going to go over the basics, and then I'll kind of just talk about what we call. So I'm saying the word client, for example, because I'm a licensed mental health counselor, and I'll explain that. So the first level, which is a master's level, would be an LMHC, which stands for licensed mental health counselor, or an LPC, depending on the state that you live in. It's called an LPC, which would be a licensed professional counselor, or an LMFT, which would be a licensed marriage and family therapist, or a licensed clinical social worker, which is an LCSW. So any of these options are great options for anybody who's looking for therapy, counseling in any particular age group or particular diagnosis or specialty. So you just really have to do research about what is the specialty that you're looking for. So are you looking for a therapist who focuses on working with children, or are you looking for a therapist who is really good with adults, or with an older adult population, etc. So there are some nuances between these titles. So somebody who's trained in for an LMHC or an LPC would be really focused on learning about the intrinsic motivation of an individual, kind of everything about the individual from the inside out. For licensed social workers, for example, that would be from the outside in. So looking at the extrinsic motivation, what are the factors in their environment that are affecting them as an individual, and trying to engage those factors and make change in that way. And then the LMFT is somebody who's trained focusing really on marriage and family issues. So if you're looking for couples therapy or family therapy, they would be a great option as well, because they really learned those systems and learned about the theory and the different types of treatment options for anybody who is struggling with those issues. So the next level would be a psychologist, and a psychologist can be titled a PsyD, which would be a doctorate of psychology, or a PhD, which would be a doctor of philosophy in psychology. So anybody who has those titles can also do therapy. But in addition, they can also do evaluation of different kinds. So they can evaluate certain conditions because they learn kind of how to do all of the, big batteries or different types of evals. So a PhD is likely to be doing research, or has done research, published some research that they've worked on throughout their grad program. And then PsyDs PhDs often teach in universities, and it's becoming now more common for PsyDs to work in universities as well. So it kind of just depends on what you're looking for. And then the last category that I'm going to mention is psychiatry, which would be an MD, a medical doctor. So they're going to medical school, they're specializing in psychiatry and treating, psychiatric conditions. So when you go to a psychiatrist, you're really looking for somebody who's going to do good evaluation about whether medication might be indicated. Now, all of the categories that I've just mentioned, every master's level up to a doctorate or a medical doctor can do therapy. Everybody can do therapy, but therapists are super trained in therapy. And then when you get up to medical doctor psychiatry, they're more trained in the medical world and understanding, again, how medicine can impact and influence an individual for the goal of their treatment. So just hopefully that gives you a good idea. And then the last thing I'm just going to mention is what we call individuals who come to look for providers. So anybody who's a master's level is going to call the individual coming to looking for treatment, they're going to call them a client, and anybody who has a doctorate is going to call them a patient. Just a nuanced technicality. It's just a way to kind of help divide the space, and again, just to give us something to say that would be different from each other, to indicate the difference. So hopefully that's helpful. Hopefully that makes things clear. It can be confusing, and this is not all encompassing. These are just the main kind of categories.